I'm Tim Malloy with the Palm Beach Civic Association. It is Monday, April the 13th. Here's the very latest, doing in conjunction, of course, with the Town of Palm Beach Fire Rescue and the police. There are new, very stern advisories from the Town of Palm Beach, and here they are. All people working in patronizing or otherwise physically present in grocery stores, restaurants, pharmacies, construction sites, public transit vehicles, vehicles for hire, and locations where social distancing measures are not possible within Palm Beach County as well as Palm Beach, should wear facial coverings as defined by the CDC. It also states that all people physically present in any public place in Palm Beach County and the Town of Palm Beach are strongly urged to wear facial coverings as defined by the CDC. We remain in a shelter-in-place order. By now, everybody knows what that means, which is essentially stay right where you are. Don't go out unless you absolutely have to the pharmacy, to get medical assistance, to your veterinarian, and to get food. Yes, exercise, but don't take a long time doing it. There was evidence this weekend that people were abiding by this. The roads were much less crowded. And we're going to talk about the risks inherent in being around people even when you exercise in a minute with Maggie Zeidman. A quiet Easter weekend. 20,000 people have contracted the coronavirus in the county so far. 9 people in the county died on Easter Sunday. And on Easter Sunday, 2 men staged a legal demonstration in front of St. Edward's Church, pleading for the doors to be open for Easter Sunday services. That, of course, was not the case and could not be the case. Many people were able to worship at their synagogues and their churches remotely. Back to shelter in place and other things you should know about. Maggie Zeidman, of course, councilwoman for the Town of Palm Beach, former chief of nursing at Lenox Hill Hospital in New York. She's got some new information you should pay attention to if you're outdoors.
Hi there. Good evening. We're a little late today, but I just wanted to drop in on you and answer or try to answer a question that is posed frequently, and we did pose to Dr. Dotson as well. And Dr. Dotson will be doing another question and answer. We'll do our duet again with Kirk Bluen and on Friday of this week at 3 p.m. It's wonderful to have someone who's so knowledgeable and gives so much to this town as David Dotson. It's very much appreciated by all of us if you're listening to Dr. Dotson. So, okay, here's the question of the day. Is the coronavirus airborne? And what does that mean? Airborne means that it exists in the air, and like measles, it would be considered an airborne infection. And is it? That's the question. Is it? Because if it is, then it makes it extremely contagious. And just going outside and breathing in the air, if someone has exhaled the virus into the air, then you may get it. So I've looked up everything I can on this, and as I say, we did ask Dr. Dotson as well. Let me just read something to you. The World Health Organization on March 27th, in answer to this question and in a response to the New England Journal of Medicine and the British Medical Journal, and you might remember we talked about there was a test done under very specific circumstances. So the assumptions would all have to be the same. They'd all have to match up to get to arrive to the same conclusion. But it found that this coronavirus, the SARS-CoV-2 virus itself, actually would hang in the air under certain conditions for up to 3 hours. But that was at a certain humidity, at a certain temperature, and all kinds of other controls. And it was a study that looked at it for medical personnel who are involved in what are called aerosol procedures, which would be putting a tube in to connect to a ventilator, giving a nebulizer treatment, suctioning a patient, things like that. So anyway, that's why that test was done. And this is the World Health Organization on March 27th. There is not sufficient evidence to suggest that SARS-CoV-2, which is the name of the virus, is airborne, except in a handful of medical contexts, such as intubation. So that's a quote. But scientists say that gathering the information to answer the question, is the coronavirus airborne and can it travel through the air and infect you? In order to gather enough evidence, it would take years to make it an unequivocal answer. It could take years and it could cost lives. So the question then becomes, so what are we supposed to do in the meantime? It's, of course, a theoretical possibility that it could happen, but is it a real possibility that it would happen to us? Is it likely, in other words? Let's go over a few terms here. What's an aerosol? What's a droplet? Because you hear both of them. Droplets are larger, and it happens when someone coughs or they sneeze. It comes out in a droplet, and the droplets, because they're larger, they're heavier, they fall to the ground quicker. Aerosols are tiny micron particles, and so they're small and they can stay suspended in the air. And how do you get an aerosol? From breathing, talking. So when a doctor is putting in an endotracheal tube to connect a person to a ventilator, or nurses are suctioning, or respiratory therapists are giving a nebulizer treatment to a patient, they're breathing. And so they're in very close contact with the breath of a patient. So aerosols are tiny, tiny, tiny. So they are not heavy. They're small, they're light, and they can stay in the air for a period of time. And that's the question that is not definitively answered for us. Is it an aerosol or is it a droplet? If it's an aerosol, can we get it if we walk on the lake trail and someone has, the question was asked of Dr. Dotson, and someone has just sneezed or coughed, can you get it? And his answer was that theoretically it's a possibility, but it's not likely because it would fall to the ground. So then the question becomes, is it an aerosol and can it stay in the air? We're not going to know the answer to that question. But I do think that it's important to know that aerosols are contained in exhaled air. So you can be sitting next to someone, talking to them, and that's been shown with the flu. There was a study done, and they looked at exhaled air from people who have influenza, and 39% of the people who had it had exhaled the virus in their exhaled breath. That's not to say, though, that that virus can cause an infection at that point. So there's just so much that's not known. So it begs the question then, and we're all going to continue to hear about this because these studies are very important. They'll continue to be done. But the real question becomes, what are we supposed to do in the meantime? Well, I think it's helpful to wear a mask, not the N95 mask. Those are needed for people who really are in touch with aerosols and in an environment where the concentration of the virus is very high. So, but wearing a mask does protect others from your exhaled breath because you may be an asymptomatic carrier, so that helps. It also, of course, everyone talks about it as being additive in that it keeps your hands away from mucous membranes, which is where the droplets or the aerosols, if they get into a mucous membrane, then they can cause an infection. So I think the best thing we can do right now is to stay away from people. Stay with the people that you are now living with, for sure, and have those conversations. But don't be around people that you don't know, because you don't know if they're an asymptomatic carrier. We don't know enough about the aerosolized version of this virus. So to be safe, do that. Wear your mask. I saw very few people wearing masks outside this weekend, but Publix, all the workers are now wearing a mask, so good for you, Publix. And people in Publix are wearing masks. I saw people going in. Again, try to stay home. The only way to do this, we can't get rid of this virus. We can only manage it until we get a vaccine. So managing it means trying to stay away from others. And unfortunately, even when we lift some of the restrictions, there will still be social distancing to a large extent in place for a while. We'll just have to see how that goes. I can't predict that. I don't have the background and I don't have a crystal ball. But please do think about this. Think about the fact that wearing the mask can be very helpful to you, not just in transmitting something to someone else, but it also is a barrier for your hands and a barrier for air, even if it's not the N95. So please, let's just move on from here, and we're going to all have to just be very, very vigilant, and we'll be very careful. We've done a great job in this town. You've done a great job. So thank you.
Hotels are closed, restaurants are closed, bars are closed, of course, and have been for a long time. Some store owners have managed to get by staying open sparingly. So what's next? Is there hope in this? Is there possibly a silver lining when this all clears away? Well, Wendy Rutledge talked to someone who says, indeed, there may be.
Tim, even though many businesses on the island of Palm Beach have temporarily closed due to the restrictions of COVID-19, and other businesses like restaurants have modified their business model to include things like takeout, Laurel Baker of the Palm Beach Chamber of Commerce actually sees a possible silver lining coming out of all of this.
I think, quite frankly, it's a great opportunity for the stores to reevaluate. And if you have this mental set of, oh, well, we're a seasonal community, when something like this hits, it has to be a wake-up call. I truly believe that retail can survive and thrive if they take a year-round attitude.
So we'll see if she's right and more businesses do keep their doors open year-round. In the meantime, for those of you who like to attend the monthly town council meeting or listen to it online, you can do that. It is this Wednesday, April 15th, starting at 9:30 in the morning. But this month, there's a catch. You must pre-register to listen. Very easy to do. Just go to townofpalmbeach.com, click on Meeting Audio, and you can register there.
Palm Beach County Food Bank has long been a very important part of our county, helping people year-round in time of need, holidays especially. But people need help right now, and they are making great strides to get food and help to people who need it. There's a lot of people in our area who are quite poor and don't have anywhere to turn. So Wendy Rutledge again now with great strides being made to help others.
Tim, as you might imagine, there is an increased demand for food from food banks everywhere, including locally. So we reached out to Palm Beach Civic Association member and Palm Beach Food Bank board member, Deborah Pasillo, to find out how her organization is coping with so many, many more people needing food.
We are knee deep in COVID-19, have been for weeks, probably will be for weeks. How has that affected the Palm Beach Food Bank?
Well, it's affected it in a number of ways. Our partner agencies are experiencing a huge increase in demand, as you can imagine, with all the unemployment. And I think we're just beginning to see the effect of the unemployment from the hospitality, the restaurants, retail, farmers. And there's just so many levels that are sort of coming together in this particular county. We find ourselves having to restrict our volunteers. We have a fabulous volunteer team that helps us obviously process the donated food with donated labor, which is one of the things I love about the organization. But now with COVID, we don't allow anyone over 60 or 65 to volunteer, which was really the hallmark of our whole entire volunteer crew. Many of the businesses that would have whole groups come, of course, aren't doing that. Breakers did that a lot. FP&L, a lot of other companies in the area would have a day when they'd have 20, 30 people come down. That can't happen right now. But we do have volunteers, and we do the physical distancing required. We can only have 5 volunteers at a time in order to accommodate that. And there's gloves and masks for all and hand sanitizer. We are getting food coming in. This time of year, it is typically a lot of fresh produce, which we are getting quite a bit of. However, most of our fresh produce that comes in a lot this time of year comes from a process called gleaning. It used to be normally before COVID, it would be after they had picked the farmers everything that was saleable. And this would be stuff that's perfectly edible, but it might not be pretty enough or the right size. I want to say 2 to 3 weeks ago, early on in the shutdown phase, coordinated effort in Palm Beach County made a decision for health reasons for the COVID to not do gleaning this year. And that has been resulting in a lot of food just laying there and rotting. The newcomers to the food banks are basically people of all ages. A lot of them, perhaps a little younger, have suddenly lost jobs, particularly in restaurants and hospitality and retail, and have never not been able to buy food and are showing up and so grateful, just so humbled, I think. People are realizing that it can happen to me. I can be the one to go pick up the box of food. Now we are finding the variety is less readily available, and meeting the needs of people when there's so many of them. We're kind of all having to go back to the early days of food banking where you prepared a box with basic stuff and every family got a box.
It wasn't but a couple of weeks ago that we covered the wonderful event, Empty Bowls. Just in the nick of time, you got that in, I would bet.
Yes. Yeah, I think 2 weeks later, and we would probably have had to cancel the event.
Is there something you'd like to tell your town, your community of Palm Beach about this effort right now?
People ask me all the time, well, what's the food bank need right now? And what we really need is just flexible dollars because we're having to purchase more food. Before COVID, God bless Publix, they would bring us 2 big, long trucks full of food twice a week. They can't do it anymore. The whole supply chain's all disrupted. They can barely fill their own shelves. We get a little something now and then, but it's very hit or miss.
We remind you at the bottom of this newscast that we're doing now, there is always the full town briefing for the day. We strongly recommend you read all of it. It has more on social distancing and what we have to look forward to and how we can all take care of each other. That's it for now. I'm Tim Malloy. We wish you the best. Stay healthy, and we'll talk to you soon.